Hello everyone and welcome to today's Vistage webinar. Before we begin, I'd like to go over some items to help you participate in today's event. If you are experiencing technical difficulties joining the webinar session, please dial support at 888-259-8414. When you join today's webinar, you've selected to join either by the phone call or through computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. During the presentation, all participants will be in listen-only mode. You are invited to submit a question through the questions pane in your control panel. A recording of this presentation will be sent to attendees via email in 24 hours. I would now like to introduce the moderator for today's webinar, Ann Petrick, Senior Director of Research.
Thank you so much. I'm happy to host this webinar, which is the latest in our Leading in Challenging Times series. And this series provides the definitive source of thought leadership on pressing topics facing small and mid-sized businesses. So combining insights from expert speakers like we have today, along with perspectives from your peers, is how we help Vistage members make critical decisions that drive growth. So today's focus is on returning to the workplace with purpose. We'll not only look at navigating regulations, but the human element of recovery as well. Joining us today are George Patrick and Ray Brock. Welcome. George is a certified HR specialist with Insperity with over 30 years experience. And Ray has been with Insperity for over 20 years and is currently Director of Safety Services. So Ray, let's turn it over to you.
Okay, thank you, Ann. So the last couple of weeks, we've been turning our attention to the momentum building across the country on the idea of returning to work. We've talked about this return to the office and return to the workplace because for many of us, it's not a question of getting back to work, as the last few weeks have been some of the hardest work of our lives as we've navigated unexpected veracity of this disruption. We've been innovating in real time and doing everything to take care of our employees, our clients, and protect the viability of our business. But now we are beginning and have received additional clarity on what it might look like to return to the workplace. And hopefully soon we'll be in a mid and hopefully a post-pandemic era. So there's several technical regulations and requirements that employers need to be aware of to protect the physical health and safety of their employees. But more than that, we need to be looking at the emotional toll of this season and what it's taken on all of us. So that notion of getting back to normal, and I put normal in quotes, may not be normal at all. I was texting with a colleague a couple weeks ago and just checking in and seeing how she was doing and really how her family was. And she literally texted back and said, I think I'm done with 2020, I'm ready for 2021. We've just been through a lot this year, and this presentation is going to go through some HR considerations that we should all be aware of as we make this transition successful. So let's talk a little bit about our agenda. And as we get started today, I'd just like to propose that we tackle a handful of key topics that are related to the idea of returning to the workplace. We want to provide some perspective on both the technical requirements and the human resource considerations on each. Sound good? Okay, let's go ahead and get started. As employers approach this time of moving back into a normal work life, one of the questions that we're going to have to ask ourselves is, what are my resources that are available to provide me guidance on technical requirements? And what are the best practices out there? Where do I find this information? Many states are issuing various plans to reopen business. Our clients' questions are around, what can I do to reopen my business in relation to state and local orders and restrictions? Some of our clients and some employers are facing hurdles around the leasing property management requirements and restrictions. So you're going back into an office that has its own requirements. There's no one size fits all to the approach for returning employees to the workplace because of all the unique requirements between state, local ordinances, and your own operations. So this particular slide captures the phased return as it was presented in Opening Up America Again guidelines. The phased return is based on gating criteria. I look at gating criteria as milestones that a region or state should meet before moving through certain phases. So it's essential that we have a downward trajectory of symptomatic cases, reported illnesses, and we have an adequate emergency response within your region. So as you can see, businesses can take great care to prevent the spread of COVID-19, but if your area is seeing a negative trend in the gating criteria, your region or state may implement more restrictive policies for businesses. So in our next slide, what I really want to talk about is what are some of the safety considerations that you need to take. And there is an increased amount of resources that are coming from a state level or a federal level. Things like the Occupational Safety and Health Administration is putting out a lot of information now for different industries in order to prepare for their employees coming back to a physical office. If you start at the top of this particular cycle, it talks about a communication plan that needs to be in place. And we're going to be talking about this communication plan because employees are feeling a level of anxiety as they move from kind of an isolated area of their own homes or not being around people to coming back into a more public environment. And I can say for my own team that communication plan is ongoing, it is frequent, and it is an opportunity for them to express their anxiety as they're coming back into the workplace and help us all work through it. So as we're putting these plans into place, I am getting, and employers should think about getting key people within their organization involved in the process. Number one, so that you know where your pinch points are, where your areas of concern are within the workplace, and also there's going to be a buy-in from your employees. So your employees not only need communication of what's going on in the workplace, but there should be a level of training. There is a lot of technical and medical information that is thrown at us in the workplace and in society alone right now, and we need to understand what some of that terminology means. In addition to the communication plan and the training plan for your worksite employees, there should be a screening process in place. Now, some employers have talked about taking temperatures in the workplace, and if you're going to go to that level, or maybe a government agency or a particular client may require you to take temperatures, you need to think about the employees that will be taking temperatures, thinking about the environment where those temperatures are taken, because what you don't want to do is create an environment where you have a group of people close to each other standing waiting for their temperature to be taken. And also the people who are taking the temperatures could be looked at as needing more personal protective equipment than just your general population. But employees need to be trained on how to screen themselves prior to coming to work. What are the CDC guidelines around the symptoms that may be associated with COVID-19? Also, what are the CDC guidelines if you are exhibiting symptoms, or if you've been around people who have potential exposure to COVID-19? Employees need to be trained on that prior to coming back into the workplace. In addition to that, cleaning and disinfecting practices need to be looked at for your work environment. If you have not been in your work environment for a period of time, definitely over 7 calendar days, the CDC states that you can do general cleaning. You don't have to do some sort of deep cleaning in your environment. However, we're dealing with anxieties and we're dealing with perceptions. So that initial return to the workplace maybe a good idea to do a deeper cleaning so that employees feel comfortable. Because if we can get our employees comfortable with returning to the workplace, we can get them back to that normal work environment, to a more productive work environment. Cleaning and disinfecting means that if you're going back into the workplace over the next 2 to 3 weeks, you need to be thinking about the supplies that are needed in order to clean and disinfect. And that also means the supplies that employees may need on site in order to maintain good personal hygiene practices, washing their hands, sanitizer. Where are you getting those supplies, and who is in charge of maintaining and anticipating future needs for those supplies. In addition to that, you need to think about maintaining social or physical distances. Social distances or physical distancing is maintaining at least 6 feet of space between you and your worksite employees. Here at Insperity, we have office spaces. We have looked at this issue in a variety of means, starting with our parking lot, where we've had a reduced workforce that has come back into the office, which means there's a lot of open spaces out there. So we've asked employees, or just reminded employees, that you don't have to immediately park right next to each other. Get out of your cars, and all of a sudden we've got a social distancing aspect. You may want to look for some remote parking, and just think about that as you come back into the workplace. In addition, obviously your high traffic times may be at shift changes in the morning and in the afternoons. If you're coming back into a leased building, you've got to think about other companies are thinking about that reduced capacity as well. That might be 25% capacity, which may mean a smaller capacity for the particular company. But if everyone is filtering through the front door of that leased space, there could be social distancing situations created, and those are things that you need to think about. In addition, if there's common areas, public areas in your leasing space, cafes, the cafes may be closed. If there's valet or parking services, those may not be opened again as well. So employees need to be aware of these things. You should be contacting your leasing, if you're leasing from a building, and talking to the building about what are you doing in the way of ventilation? What are you doing in the way of social distancing? They may have restrictions on the number of people that can get into elevators. They may also have signs and items on the floors that show where people should be standing. So these are some of the awareness signs that employees should know about prior to coming back into the building. And really that includes any of your areas as well. Conference rooms, break rooms, lunch rooms, these are all areas that you need to be taking a look at and thinking about, okay, when people come back in and they're seated at these areas, where they're going to be seated. I got a picture from one of our clients the other day of they repositioned all of the tables in their lunchroom and took out tables, and they had great distancing between employees. The one thing I noticed though is that all the tables were aligned, meaning that if you're sitting in the back row, that's great. You probably have the lowest potential for any sort of virus transmission. But if you're sitting in front of that person and that happens to be the person that may be asymptomatic or is just beginning to show symptoms, and they're sneezing or coughing, what's the route of that? So think about maybe angling the tables, maybe putting the tables in an alternate pattern so that the flow of that air is is adjusted so that people aren't right in line. We've thought about that with conference rooms as well. Repositioning seats, taking seats out, or marking spaces on the conference room where people can sit, and communicating to employees that when you come back to the workplace, you're not going to be able to come back and have a social gathering in the conference room. If you're going to order meals, or if you're going to get pizza, or we used to have Taco Tuesday, where there was a local place that we brought breakfast food in, or donuts, and everyone would come, and it was a nice social aspect. We're we're not doing that for the time being. We are getting individual lunches. We have visitor policies, and that's all to maintain these social distances. We train our employees also to understand that there are times where we may not be able to maintain social distances. And in those times, we've made a business decision. There are certain states and counties that are requiring this, but we require or ask our employees to wear face masks. And so if they're going into the break room to possibly get their lunch or something, they're gonna bring their face mask with them. And if they see people as they're approaching the break room, they're probably gonna put the face mask on. We're asking them to understand that if we have more than 2 or 3 people in that break room, if they could come back or if they could wait at a distance. So anytime that it may be a good idea to think about putting on that face mask as you're coming into the building in the morning, because there's probably going to there may be a larger population of people, and also for break areas as well. You also need to think about, as far as personal protective equipment, if you're going to have a person that is actually taking temperatures, you may want to think about giving them more personal protective equipment, because there may be asymptomatic people, or they're just they possibly have to break that social distancing. So some of our clients have actually looked at face shields, because as you look at the routes of entry for this virus, your eyes could be a route of entry as well. That may not be a primary route of entry, as the CDC is discussing, as far as breathing it in, which is why certain type of respirators are worn. But you also have to remember, for face masks, that they are to protect other people. And I think that's something we're communicating to our employees as well, is that we have a responsibility as we come back in to look out for and protect our fellow employees. And that's why we look at the use of face masks. We've also taken a look at business travel. And as we look at business travel, we're thinking around limitations of the areas that we're going. What does the data say about, what does the health data say about the areas that we're traveling to? Do these areas have any restrictions? Honestly, right now, we're asking our worksite employees to define why they think this travel is essential for our operations. And can we do this in a Zoom environment like we're doing right now? I think collectively, many of our clients and our prospects have really become experts at virtual environments and different virtual environments. And if there's a possibility to, continue that, then that should be our primary option right now, at least in this particular phase that we're in.
Great, Ray. That is a very thorough plan that you have, and I'm sure everyone was sad that Taco Tuesdays went away. Remember those things fondly. No more break room donuts.
We
I'm
miss them.
wondering, even with these plans in place, if someone had an employee that tested positive for COVID-19 and claims they contracted it at work, what should an employer do?
So that claim should be reported to your workers' compensation carrier as quickly as possible. The claims adjuster will conduct an investigation and determine if that particular claim was actually contracted at work. As we all know, COVID-19 is a very contagious virus. The compensability of each one of these cases is going to be determined based on the facts established during a good faith investigation, and also the law of jurisdiction. So there are some states, 2 of them that come to mind are Illinois and California, where there are a presumptive case of compensability So your carriers need to find out about those claim cases as quickly as possible so they can conduct their investigation, because some of these investigations have a time limit on it.
Great. Okay. Well, thank you so much, Ray. And now we're going to go to George. And so, George, we're going to talk about the return of essential and non-essential employees. And there's been a lot of talk about this idea of the essential employee, and that's kind of a loaded term. Everyone's essential, right? But when you think about different phases, that means that not every employee falls under that designation. And just from an HR sensibility standpoint, how should employers think about communicating to their entire workforce on which employees are regarded as essential and corresponding which are not, and what impact that might have in both the short and long term?
Well, that's a good question. And we're dealing with that issue all the time now. First, let's make a distinction on what's essential. There's a difference from the federal definition of essential employee, which is determined by Homeland Security under an agency called CISA, and that is the Cybersecurity and Infrastructure Agency. However, we're looking at essential employees as it's based upon operational need. So in that case, everybody is essential. It just depends upon which part of the phase are they essential to return to the workplace in. So however, with the three-phase approach that we just talked about earlier with Ray, there's definitely a phased approach to not bringing everybody back at the same time. I think the best way to do this is to review the objective criteria that you put in place for your business and how you establish which roles are essential and how that phasing will look. For example, if you can bring back a number of employees back to a facility, who will they be? What skill sets and expertise they need to have? That means they need to be in the first set of essential employees. So for example, if you have, you may want to bring back one accounting person, maybe 2 customer service reps, maybe 3 people in your warehouse, maybe 2 drivers. Again, it depends upon what you need regarding your operational needs to start that operation back up essentially in the first phase. And then of course, look at the other 2 phases and which employees need to be returned in those phases as well as the critical skill sets. Once you've done that, then it's important to communicate that entire plan to your employee base so they understand exactly where they are in this process. So no one feels like they're being left out or feel like they're not being appreciated. Again, clear communication as to what it is that you're using as requirements for these phases is going to be essential for you guys to have, for the employees to comply and come back into the office with least amount of resistance.
Great. Okay. So whether an employee is actually considered essential or not, what if someone just simply refuses to return to the workplace after a shelter-in-place order has been lifted? What do we do there?
Well, unfortunately, I'm dealing with that with a lot of my Insperity clients right now. Employees are just feeling uncomfortable right now. And we've got to remember there's a lot of emotion out there, a lot of uncertainty about even what it means to return to work. So nobody's situation is exactly the same. We have no idea what's happening within each person's household. So the biggest thing that we can do as employers is to what we call an interactive process. Have a one-on-one with the employee. Be empathetic. Speak to them. Find out what is exactly putting them in a position where they don't want to return to work. Could it be that they're just not really sure as to what the safety precautions and measures that you guys have put into place as employers? Or could it be there is something actually happening at the home front or with them personally that puts them in a position that prohibits them from coming back to place? Let them know about whatever the entire plan is around return to work, safe place, and cleaning operations, whether or not you're going to have deep cleaning disinfectant on the weekends, other cleaning materials during the week, whether or not you're going to provide protective materials or masks. Provide them with as much information so that they can make a clear decision and kind of reduce the anxiety for those employees. I think once you do that, then I think what's going to happen, you're going to find least resistance, and those persons will probably want to go ahead and return back into work. But now, if after you've done all of that and the person still decides they don't want to come in, at that point, you need to set some clear criteria. Now, here's a couple of things I'd like for you to consider. As you're putting your plan together for return to work in the phases, which of any of these positions, whether it be phase 1, phase 2, or phase 3, can still work from home for any period of time? So if you do have an employee who still, after all of the explanation, all of the details that you've given them, still do not want to come back to work, if their position still can be operated from home, then provide them a little grace and a little flexibility and allow them to continue to work from home. However, I would recommend that you put some structure behind it. So I'll use me for example. If I tell you that I'm still uncomfortable, you can say, well, George, look, I understand that your position does allow you to work from home for a short period of time, so we're going to give you 2 weeks. In that 2-week period of time, I want you to prepare yourself to come back to work, because on this date, we're going to expect you back in the office. Now, on that date, when it comes, if I still do not want to come back to work, the question from you to me as the employee is, do you still want to work? Do you still want to work here in this environment? And at that point, you need to look at your policies and then exercise them according to what the policy says.
Great. Well, it sounds like with all these different factors, you really have to think about communication, and it boils down to how you're communicating with your team. Can you share some ideas on how employers should be building out that communication plan for their teams through this time?
Absolutely. I mean, communication is absolutely the key. You can plan all you want. Your plans can be amazing, but if you don't effectively communicate with your employees, then the plans are going to be worth absolutely not the paper they're written on. So as an employer, you want to think about 2 things. Well, one main thing, that's who are your key stakeholders? First, it's going to be your employees, and then your leadership. So when you're going to communicate everything, you want to speak with your employees. Again, explain the plan to them. But let me take a step back first. Before we jump into all that, you want to make sure that you've also spoken with your stakeholders, your leadership and your managers, to make sure that they are absolutely aware of all the facets to the plan. Make sure they have input into the plan, just in case there are other variables that they're aware of that you may not be aware of that may have some sort of impact on the application of your plan. So once that's squared away, speak with your leadership, then communicate the plan specifically to your employees. Share any updated, any new or otherwise relevant policies and procedures. Reinforce those procedures that are existed prior to COVID-19. And then continue to keep them in place. Keep that in the forefront and make sure everyone's clearly aware of those policies. Oftentimes, we have policies in our handbook and they just kind of sit there and people just kind of operate, on a day-to-day basis without thinking anything about those policies. Well, now is the time to make sure that those policies are clear and the application of those policies are precise. So the second thing is speaking to your stakeholders. Once you do that, speaking with your line managers, your supervisors, your executives, you want to make sure you encourage them to understand exactly what is happening in that setting. Making sure that everyone's on board with the plan is going to be key to the execution all these areas. But the last thing I want to mention here with regard to communication is training. Before you bring anyone back into the workplace, you want to make sure your managers are trained on the policies. Current policies that have been in place, such as your FMLA policies, your vacation or PTO policies. You want to make sure they're trained on the new current laws that come into place under the FFCRA, such as the emergency paid sick leave or the emergency FMLA. The other parts you want to train them on is the what ifs. What do we do if this happens? What do we do if an employee says they've tested positive? What do we do if an employee says they've been exposed? Run that scenario through in your training process so that when that occurs, they know exactly what to do and how to implement those practices. The importance of that is because once you follow those procedures and those protocols, it helps to ensure and minimize your liability just in case someone comes back later and says that you as the employer did not do enough to ensure their safety. So having proper guidelines and protocols in place and ensuring that everyone is aware of those and then how to proceed accordingly is going to be essential to your communication and your successful operations for returning to work.
All right, great. Well, in the next slide, you shared some different scenarios, and here's one. What should employers do if their employees, their kids, the employees' kids, when schools are closed, but someone needs to return to work in order to keep the business going? Like, what are the considerations there, George?
Well, this is a real fundamental problem, and the problem has shifted. Now that we are into the summertime, it's shifted drastically. Before we came into the summer, we were very clear as to which schools were closed and why they were closed and the daycares that were closed. But now that we're having some of the economy's coming back and we're opening up, a lot more businesses, schools are closed for the summer. You've got to distinguish between those problems or issues with our employees that are COVID related or just related or based on just lack of planning on the employee's part. So if you have an employee who just have a child care issue, part of one of the requirements that are out there now is that you need to ask the employee, get the employee's child's name, the facility, childcare, or school that is closed, and what they were closed for. Is it closed due to COVID-19? Is it closed due to whatever the reasons are? And you need to keep that documented. If an employee does fall in line with those eligibility requirements for having a school closed, then they may be qualified for the emergency FMLA, or they may be qualified under the emergency paid sick leave. So first and foremost, you want to make sure that you speak with that employee, find out exactly what it is that the issue is around the school closing. If it's due to lack of planning, that's something that you'd have to address as you would any other time as an employee relation issue, and their ability to come to work and maintain their attendance and things of that sort. Otherwise, try to have some flexibility. Again, we're in a very precarious time at this stage in our lives, and so a lot of people are not really sure what to do. So the more flexibility that you have with your employees with regard to child care and safety issues, the better off you'll be with getting those employees back to work and being compliant with your policies and your processes.
Great. So if an employee is exhausted all of their emergency FMLA time, but a child's school is still closed until the fall and the child care provider is shut down, what options do they have after they've run out of their FMLA time?
Well, again, talk to your employee. Find out or determine how long they need to find sufficient child care. Again, these are probably employees that have worked for you for years. They've probably been great employees. So we don't want to just clearly cut them off. Find out exactly what they need, how much time they need to put together sufficient child care. If it's another week or two, offer them that flexibility and that latitude in order to get it taken care of. Just remember this here. You are no longer required to pay that employee wages based on the fact that they don't have child care any longer, if in fact they've exhausted their emergency FMLA. But again, you want to make sure, if you're able to, give them some latitude, some grace, provide them either some way of compensation if you can, but again, you are not required to pay them once the emergency FMLA has been exhausted. You may also want to provide them with information to the Employee Assistance Program, the EAP program. The EAP program, although it's designed to help with counseling, it has a number of other areas that it supports employees in with regard to adult care, child care. So give them the numbers to the EAP line so they can reach out to them and aid them as well as finding additional child care.
Oh, thank you. That's a great resource. So now in the next slide, let's go back to work and talk about some of the potential risks of actually returning to the workplace. And after shelter in place orders are lifted, and we're supposed to come to work without a mask, and an employee might refuse. What are your thoughts around that?
Well, one thing you're going to probably hear me say throughout this webinar when it comes to HR is there's never no yes or no. Everything is maybe and it depends. So can an employee refuse to wear a mask? Well, it depends. It depends on, one, if there's some sort of religious sort of affiliation with the reason why they can't or won't wear a mask. Is it due to some sort of medical condition that prohibits them from having a mask? Or is it policy? If it's policy, then you want to talk to that employee. Well, first of all, you want to talk to them anyway to find out exactly what the reason is for them wanting not to wear the mask. If it's not for the first two examples that I gave, such as religious or medical reason, then find out the other reason. But what's most important here, and I will stress this to everyone on the call, if you have a policy in place that requires your employees to wear a mask, then you must be strict about making sure those employees who can wear the mask need to wear the mask. If you find that your policy is not being followed, you can put yourself at risk from a liability standpoint, because again, based on our earlier conversation with Ray, what if in fact someone says they claim that they contracted the COVID-19 in the workplace? Well, one of their defensible items might be is that, well, you have people in the office not following the policy. We have people who are not wearing masks and some who are wearing masks, and the policy is that everyone must. So if you're going to put a policy in place, make sure that everyone is adhered to it, they understand it, and they follow the policy. Otherwise, talk to that employee, find out what's bothering them, help them to understand that the policy is important and why it's important. It's about their safety and the safety of their coworkers and your other employees.
Okay. So just a follow-up question to that. To what degree is the business actually responsible for, the face masks? Should employees be responsible for bringing their own protective gear, or is that something that employers should provide if you have a policy?
Well, but let me back up. There's two things. OSHA has standards out. The first part of OSHA standards stipulates, and I'm just going to paraphrase here, basically that the employer has a duty and responsibility to make sure that their workplace is clean and free and reduces the ability to contract any sort of infectious disease. The other part of that standard is that the employee, once that's been done, the employee has an obligation to follow the company policy and rules. So in this case, I would recommend that, depending upon your employee base, if you're going to require them to have masks or personal protective equipment, if you're able to, I would provide that. Therefore, there's no issue, no reason why an employee shouldn't do it. The other thing is maybe you provide the mask, but allow them to bring their own mask in as well. Some people don't like the mask that the employers provide, but what we're trying to do here is provide them an opportunity to make sure they're able to adhere to the policy. So if you're able to, I'd say provide masks and allow them to bring their own mask. And if you need to, set some requirements around the type of mask that they need to have if necessary.
Okay, great. So another question about coming back and people who may have been positive or exposed to this and limiting the exposure for your employees. What if you have at least one employee who's tested positive, and when you officially open back up, how do you handle those circumstances?
So here's a couple key things to remember here. In this particular question, what I would look for is not have they tested positive, but are they currently in a positive a current positive mode, meaning are they under quarantine right now? Clearly, if they're under quarantine, there's a set of protocols and guidelines from the CDC that requires them to stay home and quarantine, and then the steps behind that, and we'll get in that a little bit later. However, if a person has tested positive prior to coming back to work, to the workplace, and they've been cleared, then yes, allow them back to work. Now, what some employers have been doing, including Insperity, since we've all been working from home in the last 3 months, and no one's been in our corporate office or in our affiliate offices, every time there's been an employee at Insperity that has tested positive, an email has gone out indicating that we've had someone who's tested positive. They're not in the office, so therefore there is no concern for contagion or transmittal of the COVID virus. Please keep them in your prayers. Keep everybody notified. If you're able to do that, and of course leave the employee's name out, then everyone's aware of some of the things that have taken place prior to returning to work. And again, it does not make a difference if they tested positive before. As long as they are clear to return to work, they should come back to work.
Okay, great. So now is a great time. I know some of our companies are actually taking advantage of the opportunity to upgrade their talent or fill open positions. And so while some companies have been virtual and may have been interviewing for roles online or digitally, when it comes to coming into the office, are you allowed to ask interview candidates about a possible exposure or even require them to get tested before they come to the office?
Yes, you are. As a matter of fact, the EEOC has put out guidelines on that. And yes, you can ask a person if they've tested positive or been exposed. However, you cannot ask that question until after a conditional offer of employment has been accepted to that candidate. So yes, you can ask. Now, when it comes to testing from a pre-employment standpoint, you're able to do that as well. However, I tell my clients this kind of guidance. You've got to look at the end result. What are you trying to accomplish by putting certain measures into place? So if you want to do a pre-employment COVID-19 testing as a condition of employment, you've got to determine what facility are you going to go to, what's local in your area or local for your candidate pool, such as you would do when they go to LabCorp or LabQuest to do their drug screening. Is there a facility in their area? Determine what your candidate pool area is. In addition to that, who's going to pay for that up front? Are you guys going to assume the responsibility for that? And if so, that's fine. Just make sure that's a part of your plan. In addition to that, what are going to be your plan, the plan in place if in fact the employee does test positive or the candidate tests positive? Are you going to extend the offer for another 2 weeks, allowing them to clear? Is it automatically going to be a rescindive offer to that employee? These are some of the questions that you'll need to answer before you put that sort of practice into play. But the end result is that, yes, you can ask the question once a conditional offer has been put in place, and you can make it a part of your pre-employment process. Just make sure that you have these questions, as I mentioned before, answered and in place as a part of your process.
Great. There's a lot of questions around policies and changing policies. And I had one come in that said, if someone tests positive, do we have to shut down and send everyone home? And, what's the policy around if you have someone in the workplace who actually tests positive once you've returned to work?
Well, once again, that depends. However, here is the guidelines from the CDC. If a person has tested positive, you get a phone call, you get a phone call and the employee says, George says, hey, I just want to call you and let you know that I tested positive for COVID-19. Immediately, what you are to do before you let that employee disconnect on the phone is to find out who they've been in contact with in the last 14 days, that they've been in contact with for a period of 10 minutes or longer within a 6 feet radius. Once you identify those employees, we need to send communication directly to those employees to let them know that they have potentially been exposed to COVID-19. And then those employees, according to guidance, should be sent home and quarantined for 14 days, including, of course, the person who called with a positive case. However, the rest of the organization should be sent an email out to identify that there is an employee who has tested positive, and those individuals who may have come in contact with that employee have been notified, and we are working with them specifically. So therefore, it takes out that sort of a fear as, oh my God, am I the person that they spoke with? Did I talk to George the other day? Was it 2 weeks ago? So if you put that sort of communication out there, then that kind of takes some of the anxiety out of from the rest of the staff. Once that person has cleared, then they can come back to work. Now, you also want to make sure your communication that you make that apparent that that individual who tested positive will not return to work until they have been cleared by a medical provider. So again, you want to make sure that you identify who that person's been in contact with. You want to contact those individuals who they've been in contact with to make sure that that they're notified and that they get quarantined, and then communicate to your staff that this has been a potential exposure. After that, once they get clear from the doctor, bring them back to work.
George, this is Ray. Just wanted to dovetail on that. I think one other area that you want to be thinking about is if you have a large facility, where does that person work? Isolating the areas that that person works and has possibly traveled, and look at doing a potentially deeper cleaning than what your facility may normally do. So you have normal cleaning throughout your facility, but if you have a COVID-19 positive case, then you're working with your leasing management company, you're working with your facilities department to do a deeper cleaning.
Yes, and thank you for that, Ray. In addition to that, if you've not been in contact for 7 days, then what they're saying is you don't have to do a deep cleaning, but that may be recommended. But most importantly, and Ray brought a good point up, make sure you contact your facility management if you are leasing space in a building to inform them, because there are protocols they have to put in place in case the person's been on the elevator, in the stairwell, or what have you. So make sure you notify your property manager as well.
A lot of consideration. So Ray, thanks for popping on and sharing your insights. And we're actually going to come back to you talking about in the next slide, employee claim consideration. So now, what if someone has coronavirus, and is this something that can be compensated under workers' compensation?
So we talked about this partially a little earlier, but that really depends on the facts and circumstances of the individual situations, along with the unique state laws. So that is why it's important to get that claim reported to your workers' compensation carrier as quickly as possible. Also, if your employee thinks they have COVID-19, obviously you want to take some action as an employer, or encourage them to take action if they're symptomatic. But if they would like to report it, then the employee should be directed, and your carrier and your third-party administrator will give some direction, or should give some direction around this. But you should get a positive test for COVID-19, and this is part of that investigation process. If the testing is negative, your carrier or third-party administrator may complete a record-only claim, and that may be filed with your carrier, and the diagnostic testing results documented appropriately. If it's positive, and then you should file a claim, and it will be escalated through the adjuster for an investigation and compensability determination. So this is a very fluid situation. within the states and how government agencies are reacting to the crisis. So Insperity and our third-party administrator and our workers' compensation continues to monitor the developments.
Okay, great. Thank you so much. So just to think about some different scenarios, let's go back to George, and we're going to talk about in the next slide a couple scenarios. So first is attending work and COVID-19 symptoms. So share with us some of these scenarios and what some of your recommendations are. So for example, here we've got Tammy can't perform her job remotely. She called in sick on Wednesday. Saying she has a fever and flu-like symptoms. What should Sally tell Tammy about her absence as her boss?
Sally should definitely tell Tammy to stay home and recover. And should call Sally on occasion to find out how she's doing, and before she returns to work, to make sure that all the things are in place, such as having the proper doctor's return to work certifications. Sally should also inform Tammy that she will need to answer the CDC screening questions before returning to work. And the reason why there's a distinction there, because in some cases when there's not a test case available or a testing facility available, then they have what's called a home isolation and return to work from isolation without having a base test. That recommendation, as seen here in the slide, asks that employee to determine if they've had a fever in the last 72 hours without mitigating medications. All their symptoms have been improved, and at least 7 days has passed since the symptoms first appeared. Now, let me make a caveat here, because the guidance has been changing. Since we've created the slideshow, the guidance has now changed to, instead of 7 days, at least 10 days have passed since the symptoms have first appeared. So if there is not a test available for the employee to go and have taken, then they can follow these CDC guidelines for release from home isolation. Finally, Sally may suggest that Tammy seek guidance from her telehealth professional regarding her symptoms. Now, one thing I want to add to that is what's important is that we want to make sure that we are providing the employees with the right sort of information. Because if, in fact, the employee does have symptoms related to COVID-19, he or she may qualify under the emergency paid sick leave. But if they do not seek medical guidance or medical advice, which is a stipulation in the guidelines for emergency paid sick leave, then they may not qualify for it. So again, you want to make sure that as an employer, you tell your employee to follow these steps that you see right here. However, suggest to them that they may want to reach out to their healthcare professional, that this may help them to qualify for emergency paid sick leave so they can have some sort of income during this quarantine time.
Okay, great. Well, thank you very much. I think we're going to skip through the next slides and scenarios because I really want to talk about, there's a lot of things going on. Employees might have their own uncertainty. They might have a lot of fear. We're all dealing with this as leaders, how we look at that. So I want to look at the slide about American entrepreneur resiliency. And we know that this is really important here. And while we know that we're on our way to recovery and rebuilding our economy at a local and national level, small businesses are going to need more employee engagement, and culture is more important than ever. So can you share what advice do you have for our attendees today on maintaining a level of employee engagement and protecting your culture in this era of social distancing and radical change like we're going through today?
Absolutely. Sometimes we get stuck on technical pieces and forget about what's important. But it's better time now than ever to really revisit how we were building our teams and our experiences with our teams. The landscape for us has completely changed. So if you've historically had picnics and social hours, clearly we're not going to be doing that right now. However, this is a great opportunity to have your supervisors and managers sit down and talk with their employees and figure out what drives them, what works for them right now. What are some different things that they can do in order to maintain their engagement? You may be surprised that sometimes the things that we think are impactful are not. So again, talking to your employees, you'll find that there's some adapting things that can be done in the short term and the long term. The key is that your employees are going to see that you care and that you want to do something different and you want to keep them motivated and engaged during this time. And this will really help you and your employees in the long run. And remember, there are other key things that you can do as well if you want to maintain your team efforts. You can do, for example, what we do here in Insperity. We've been doing trivia questions, trivia sort of engagements every week. All of us get together through Zoom. We Some days the theme is Walt Disney, or could be superheroes, and we have a whole trivia thing behind that. We also met once a week as well, just to talk about what's happening in the workplace, what's happening with people independently, in their environment. Again, we want to keep connection with our employees. That helps to shape and continue our culture as we move forward.
Great. Well, let's talk about how we could reevaluate your workplace culture. And, what are some of the components to that?
Well, again, you want to ask the questions. Look at the things that worked for you when we were back in the office before this pandemic. Really evaluate what really worked for you then, and what didn't work and why. Try and take those very same things and look at it from now a virtual standpoint. What can we do virtually? How can we use technology now to support this new landscape that we're in? Once you do those things and set it up, those are the things that you can do to turn the workplace into a positive sort of situation. Looking again at how people are responding to the challenges that are out here, the anxieties, we can make gains out of those, as I just mentioned before. We can have team building events that are virtual as well. So those are some things I would look at from a positive standpoint in order to continue to encourage and rebuild your culture remotely.
Okay, well, talking about rebuilding your workplace culture, how can you engage employees? Talk a little bit about how you can get some ideas to meet their needs.
Well, one of the things that you can do is surveys. Formulate a committee, a culture committee, or something just as simple as a few individuals if you're a smaller company, key individuals, key management or leadership individuals, and doing a survey to find out exactly where people are with their current situation, with their engagement, determine their engagement and productivity. And then you want to take that information and reinstate that into your workplace. What's most important is when we do these surveys, make sure that information that you get, you communicate back to the employees what the outcome of the survey is, and then what your intent is based on the data that you got from the survey, and put that into practice. Soliciting ideas from the employees for their changes and ways to implement them, and adopting our good concepts. Take time now, identify the areas that you must, and involve the employees, as I said before. Right now, as organizations, we realize the need to shift and pivot our company culture, and that's okay. Just make sure we're flexible with scheduling. If you've had reductions in your workforce, redefine and maximize your available people and resources by cross-team training and collaboration, which is really important because we're not through this pandemic yet. There may be a resurgence of this COVID-19, and we want to be prepared now. Now that we've had some of the exposure to this early on, let's find out now what positions do we need to cross-train on, and what positions do we need to collaborate on, just in case we need to backfill and put some contingencies into place. There might be a sense of pride among some team members that have survived the virus, so bring these people together. This is going to improve relationship amongst your team members as well. Lastly, lead with empathy. I just can't express that enough. Lead with empathy. Understand, truly listening to your employees is going to be key. The reason for that is we're looking at your brand as well. When this is all said and done, what are people going to say about you as an employer and as a company? What did you do for them? How did you communicate to them? Were you clear and concise? Were you empathetic, or were you short? Was your communication jagged? So again, look at your brand and in your communication as to how this is going to be related to your employees. Maybe you want to order lunches in sometimes to help people out. If so, what we used to do here is we would put out DoorDash cards to all of our employees, and then we'd have a virtual lunch together. So these are some things that you can do, but make sure, again, you're opening up with empathy and understanding to all your employees.
Great. All right. So I know that you have another session coming up. So I didn't know if we want to bring Ray back for just some key takeaways and to share some of the resources that Insperity has to offer.
Sure. And I would say everyone can read the slides, but one of the things that I just wanted to say was for the people who attended this particular webinar today, just being here says a lot about you. I think you're resilient, you're planning for the future, and you care about your business and you care about your employees. So I would encourage you to reach out to your insurance carriers, your insurance brokers, and other professionals to help you understand how to safely return employees to the physical workplace. So I think you've done incredible things both with your employees and for your employees, and I would just encourage you to continue to do that.
Okay, thank you. So so our experts can get to their next engagement, I just wanted to thank you so much for being here and sharing your insights, George and Ray. And for our attendees, We'll send a recording of today's webinar within 24 hours, and the slides were available in the handout section of the webinar pane. Now, this was part of a series. So in the last slide, just reminding you that this is our Leading and Challenging Time series, and you can always find any upcoming or previously recorded webinars at vistage.com/webinar. That's vistage.com/webinar. And for the members of our Vistage community, next week, our Leading and Challenging Times series will feature best-selling author and leadership coach, John C. Maxwell. So watch your email for details on how you can watch the insights he's sharing exclusively with the Vistage community. So thank you so much to Insperity and our presenters today, Ray and George, and be safe and be well.
Thank you.
Thank you.